and welcome. I'm Dr. Deuk Majin. We are performing a treatment for facet joint pain on this patient with horrible back pain. He travels to us from Alaska and Montana. He has homes in both, so hard for me to say where he's really from. He may have a preference. Okay, show us the facet joint. We're going to be treating the right L3-4, L4-5, L5-S1. There, the arrow is pointing to the joint. Circle the two facets, the superior and inferior, yes. That's it. So, look where my probe is. Show us the tip of the probe. We're at the bottom of the transverse process on the right side at L3. And there, right where the arrow is now, you see the top of the TP? That's where I want to be. Okay, our patient has some scoliosis. He just had the shot, Deuk laser disc repair for his discs. All right, you see the position of the probe now? That is the most perfect spot a doctor can get to for this procedure. And that's where you want to be, that one exact spot. If you're there, then that's where the pain nerve is, shot. And exactly where my tip is, okay? So, now, what's there? It's called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. What is the medial branch of the dorsal ramus? It's literally a small nerve that goes and innervates the facet joint. And I didn't discover this nerve. It's been discovered by others long before me. And they've been trying to, pain management doctors try to destroy it with a procedure called an RFA. Some of you have heard of RFA, radio frequency ablation. It's been around for a while. And the truth is, it's a great idea, but it doesn't work. It only temporarily works, and then patients have to come back and get it done again. Show us the perfect spot, right where I'm at. So this is the L4. It's the exact perfect spot. It's a junction where the transverse process and the superior articular facet, 5 minutes, less than 5 minutes, they meet, okay? That's where this nerve is. It lives here. And I know that, and that's why I'm targeting it. So the problem with radio frequency ablation, it doesn't work and it doesn't last. So when it does work, it may work for a few weeks, few months. You got to keep coming back. The problem is, who wants to keep going back to the pain management doctor? Do you? No. You guys, we all want to go get fixed and be done. And same thing, Deuk Spine's philosophy is to permanently fix people, not make them keep coming back for pain treatments. So because we want to permanently fix our patients, we develop treatments that are permanent. Now you could ask yourself, why didn't other doctors do these? And unfortunately, I know the answer. It's because they don't want you to be fixed. They want you in pain. Let's face it, pain management is a booming business. It's exploding in popularity. More and more doctors are going into pain management. It's basically guaranteed money because there are so many people with back pain and neck pain. And as long as you can keep them coming back, getting treatments, you're going to be making a lot of money. You're a millionaire. So all these doctors that treat pain, is this a new probe? Yeah. It's beautiful. It doesn't fray at all. Yeah, same price? Same price. All right. What I was saying is, as long as patients keep coming back, you're going to keep making money on them. So unfortunately, the whole industry is so corrupt. It's all done. It's all set on basically taking people in pain and keeping them in pain. Now, Deuk Spine is different. We want to take people in pain, and we want to see where the tip is. That's the perfect spot right there. Show us, Jordan, right there. The little valley there in the bone. That's where the nerve is. I just cut it. And that's a pain nerve. It's not the nerve that goes down your leg. That would be malpractice. This is a pain nerve. It does nothing but cause pain. Next patient will be a cervical, same thing but in the neck for cervical facet. We're not going to be broadcasting because that patient will be in another room that we don't have cameras for. If you want to make a donation, we'll put some cameras in there and we can broadcast. That said, any questions about the Deuk plasma rhizotomy lumbar?
No current questions.
Have a nice day. Thanks. Great job, everybody.